Good afternoon, everyone. My name is Elisabeth Mungai, and today I'll be discussing data analysis and NHSN. So the topics we will cover today will review some of the lab event categorizations that Angela discussed earlier. We'll talk about data quality checks, specifically resolving alerts, and we'll talk about data analysis, including generating data sets and some of the NHSN reports. So all lab ID events are categorized based on the specimen collection date and the date of current admission. So as you remember from this morning, the community onset lab ID events are events where the specimen collection day is within 3 days of the admission day. And the long-term care facility onset lab ID events are events that are where the specimen collection day is day 4 or more from the current admission day. The acute care transfer, long-term care onset are a subset of the long-term care onset events, where the specimen collection date is within 4 weeks from transfer from an acute care facility. And I have a little diagram here. So if we look at this particular resident, so they were admitted on February 4th. Date of admission here is considered day 1. So a community onset event would be an event that is where the specimen collection date is on February 4th through 6th. So that's day 1, day 2, or day 3. That would be a community onset event. Any specimen collected on February 7th forward, so that is day 4 forward, would be considered a long-term care facility onset event. A quick note on the acute care transfer long-term care facility onset. This question is found on the event information section of the resident event page of NHSN. And acute care facilities are hospitals, long-term care acute hospitals, and acute inpatient rehabilitation facilities. The question will ask whether the resident has been transferred from an acute care facility in the past 4 weeks. You would select yes if that is correct, or no if yes if the patient was directly admitted into your facility from an acute care facility. Otherwise, you would select no. So additionally, the NHSN application further categorizes CDI lab ID events based on current specimen collection date relative to the date of prior lab ID events. So you have incident lab ID events, which would be events that are entered for a resident, the first event entered for a resident while in the facility, or a specimen collected greater than 8 weeks after the most recent CDI event. And recurrent lab ID events, CDI lab ID events, would be events that are collected between 2 to 8 weeks after the last CDI lab ID event. So here I have a little quiz. So to illustrate, in this example, we have a resident with a CDI event with a specimen collection date on June the 1st. About 5 weeks later, on July 9th, the resident has a positive lab ID test. Is this an incident or recurrent event? Who says incident? Recurrent? And we're looking at the second line, sorry. So July 9th, incident or recurrent? Recurrent? So this would be a recurrent event because it falls between 2 to 8 weeks since the last lab ID event on June the 1st. Our next example, we have another CDI lab ID test for this event in November. So would this be an incident or a recurrent event? Who says incident? Recurrent? So this would be an incident event because it occurred greater than 8 weeks after the last CDI lab ID event on July the 9th. So switching gears, we're going to be talking about resolving alerts. So earlier in the day, Angela kind of briefly mentioned this. So the alerts page appears as soon as you log into NHSN. But another way you can get to this page, if you were on another page, would be to click on the Alerts tab on the menu bar. So alerts are triggered by monthly reporting plans. For example, if a monthly reporting plan is filled, but there are no associated events or summary data for that month, you would get an alert for missing events or missing summary data. So it's very important to resolve alerts in order to ensure that your reports are completed in the system. So to see a specific event, first I'm going to click on the missing events. So this opens the alert page. And although we clicked on missing events, once the alert page is opened, you can see that you can access the other alerts using the tabs above the table. So the first column on this table tells you the month and year where the issue occurred. The second column shows the type of alert. And the third column shows you the event type. The fourth column is a summary data form. It takes you directly to the forms in question. And the last column is the report no events column. So in our example here, if we decided that we actually did not have any events to report for MRSA, we could click the report no events column, as you see here, and the system would show you on the message that says the missing event was updated successfully. So then this event would disappear from our list. So we've resolved this since we've mentioned that we had no events for MRSA. So another way to update is to click the link under the summary data form type, in this case, the MDRO for VRE. We can also get to the summary event page if we go back to the menu, click on summary data and click on incomplete. Those two, that will also lead you to this is your event summary, the denominator page that you are supposed to be updating. The red asterisk indicates items that need to be resolved. Here you can click on the no report, no events row that's marked by the green arrow. Or if everything is as you wanted it to be and you do have events to enter for VRE, Klebsiella, E. coli, then you would leave everything the same and click on save. Then you'll get the message that you still don't have any events for these pages, but that's okay. You click OK, and you would return to the Events tab under Menu and click on Add. And you would fill out your events as Angela mentioned earlier. So once the events have been resolved, the next step is to analyze the data. So I wanted to just ask a quick show of hands. Who has gone in and done some analysis reports in NHSN? Okay. So I'm hoping today we'll be going through some of the standard reports that are produced by NHSN. So I'm hoping that this, after this, you could use this as kind of a guide to explore other reports that you haven't seen yet, or even we will talk a little bit about how you might even want to modify the report to tailor it to your needs. So to access the analysis page, you would navigate to Analysis, and there you'll find options for generating data sets and reports. The options for analysis are organized by module. So you have the MDRO CDI module, the HAI module, Process and Measures, and the Advanced folder. For today, I'll just be focusing on the MDRO and HAI modules. First, I will discuss an overview of the reports available in the module, and we'll be looking at the MDRO module. So clicking on the module allows access to the reports available for each of the organism. For example, clicking on MDRO opens up the subfolders for lab ID events, MRSA, CDIV, VRE, etc. The calculations and the analysis reports are based on metrics defined in the protocol. Here, I'm showing just a glimpse of what you can find in the protocols for both the CDI MDRO, as well as, I'll show on another slide, the UTI protocol. And these are some of the MDRO protocols, and this is how later on when we look at the tables for rates and counts and for community onsets and long-term care onset, these are the metrics that are behind those calculations. And finally, these are the metrics for the UTI data analysis. And as I mentioned, all of these are in your 2017 protocols. So we'll step back a bit to talk about generating data sets. So the first step in analyzing data in NHSN is generating your data sets. Generating data sets copies and freezes the data and organizes it, which allows for faster generation of reports. Each user has his or her own data sets, so the changes you make to your analysis does not affect other users looking at the data in your facility. To generate data sets, you would navigate to the menu, click on Analysis, and then click on Generate Datasets. This leads to the Generate Datasets page. So you would first click on the box that I've highlighted with the green circle, which says Include all data reported to NHSN. So this box, what this box does, if you have been entering data into NHSN from 2013 or 14, you would want to click this box because then you would get all of the data that you have entered since then. If you leave this box blank, the system would automatically create reports that would include only the most recent past 3 calendar years. So you would miss, if you had further previous years than that, you wouldn't see those data unless you click that box. So next I would click on Generate New. And here, and next, the page will give you an idea of how long this process is taking. So depending on how much data you have in NHSN, this may take a little while. And during that time, you could navigate within the application while this is occurring. So a quick analysis tip. Since generating data sets freezes your data, changes made to NHSN, such as new events that are reported or denominator data that is entered will not be represented in the reports that you produce until you generate data sets again. So it's a good idea to have the habit to frequently generate your data sets before you analyze your data. So now I'll discuss the analysis reports available in NHSN, such as line lists and rate tables. So once you've generated your data sets, you're ready to run these analysis reports. To access the reports, you would navigate to the Analysis tab under the menu, and you would click on Reports. So the line list allows users to see a record-level review of the data, while the rate tables display the facility's calculated rates. Both of these are helpful in pinpointing issues and validity in your data. So first, I'll discuss how to view and interpret line lists. In this example, we're going to start with events under the MDRO module. So if you click on MDRO, we're going to look at all lab ID events. So if you click on this folder, you'll get the drop-down list for line lists. And if we click on that, the next drop-down list will give us the option to run reports. So this is the standard line list report created in NHSN, and it'll show on a separate output window from the window that you're running the application on. For the purposes of this discussion, I've labeled the columns from 1 to 10. Column 1 is the org ID assigned by NHSN. Column 2 is the resident ID assigned by the nursing home at the time the event is entered. Column 3 shows the current admission date for the residents with a CDI event. Column 5 is the event date for each of the event entered, and for this table, the system will automatically sort the table chronologically by event date. Column 6 is a specific org type. Since here we're looking at all lab IDs, so you'll notice that we have CDI, we have MRSA, we have VRE. Column 7 is the specimen source. Column 8 shows your location. Column 9 and 10 shows the difference. So earlier in the day, Angela mentioned a change in NHSN. There a question in the event form that previously asked whether or not you had a resident that was transferred from a facility within the past 3 months. And that question was changed to the past 4 weeks. So these two columns, 9 and 10, prior to 2016, that question was worded to ask for the past 3 months. So that is reflected in column 9. You see the answers to that questions are in column 9. Column 10, it reflects from 2016 forward when that question is reflecting whether or not your residents were transferred into the facility within the past 4 weeks. The next thing to pay attention to is the footnotes at the bottom of the table. So in this case, I'll read this since it's really small. So the footnotes will tell you when the data you're looking at, when it was last generated. In this case, if say you're looking at this table and you're missing information, that would be a good time to check to see when was the last time I generated this data set, and to go back and generate your data sets if it's been a while. The next line list that I'll discuss is for CDI events. To access that report, we'll return to the analysis menu, click on MDRO, and we'll go down the list to click on all CD Facil Lab ID events, and we'll run that report. As in the previous line list, I've labeled the columns from 1 to 10. The line list has the same information as the previous for all lab ID events, but here, column 6, the specific org type, only lists C. difficile, since we're looking at all CDI lab ID events. And this example from our test facility, we can see that several of our CDI cases right here occurred in February 1st, and all of them occurred in one specific location. This is one example of how you could look at your line lists and pick out trends happening in your facility. Where are these events occurring? The dates, the locations themselves. So you could take a look at, to have a quick visual of these sort of trends when you use this table. So now I'll switch gear to the next module, the HAI module. So here we're going to be looking at the all UTI events. So here we'll click on the line list and then run reports. For the all UTI events report column, column 1 through 5 are the same as our lab ID events and represents the org ID, resident ID, admission date, event ID, and event date. As in the previous line list, this table is also sorted chronologically by your event date. Column 6 is your specific event. For UTI, if you remember, you have a booty, you have your symptomatic catheter-associated symptomatic UTIs, and your non-symptomatic UTI events. Column 7 shows whether or not we had the catheter status for your residents, whether it was in place or neither. And column 8 shows the location for each event. So the next set of tables we're going to look at are the rate tables that are available in NHSN. So to access those tables, you would click, so we're going to go back to the MDRO module, and now we're going to look at all MRSA Lab ID events. And if you click on that folder, you'll see the next option down from line list are the rate tables for MRSA data. So we'll click on Run. So the analysis output for rate tables show on a separate output window. And the output provides about 5 to 7 tables, and on that window you have a scroll bar that you can use to access all of your tables. For this presentation, I'll be discussing one of these rate tables for MRSA. So this table displays the rates for long-term care onset MRSA. Here the columns are labeled from 1 to 5. Column 1, we see the data is summarized by year and month. Row 1 is January 2015. Row 2 is February. Column 2 shows that the reporting is facility-wide, which will always be the case for Lab ID and UTI events in all cases. Column 3 shows the long-term care onset MRSA count based on the events submitted for each of these months. Column 4 shows your number of resident days. Column 5 shows your long-term care MRSA rate, which is calculated by dividing column 3, your MRSA long-term care onset count, by your number of resident days times 1,000. And the multiplier here that we use, 1,000, makes sure that the rates are standardized so that you can compare your rates from one month to the other, even though your resident days may change from month to month. So the next rate table we'll discuss is the all CDI Lab ID event rate. Again, I want to remind you that this will appear in a separate window, and we can use the scroll bar to look at all of the tables. So this table describes the percent of CDI events that are long-term care onset, and the percent of LOs that are acute care transfer long-term care onset. As a reminder, the acute care transfer long-term care onset events are those occurring in residents who have a CDI event date within 4 weeks of being transferred to the nursing home from an acute care facility. So as in previous tables, column 1 tells you that this table we're looking at year and month data. Column 3 shows you the CDI count, total CDI count. Column 4 shows you the CDI long-term care onset count. Column 5 shows you the percent of long-term care onset, which is calculated by, which is calculated by dividing column 4, the CDI LO count, by the total CDI count on column 3. Column 6 is the count of acute care transfer long-term care onset. And column 7 is your percentage of long-term care onset, percentage of long-term care onset. And we calculate that by dividing the column 6, which is the count of acute care transfer long-term care onset, by column 4, which is your long-term care onset count. Here I'd like to direct your attention to the footnotes at the bottom. The footnotes for this table gives a description of how the calculations that are done for each of these columns, for the percentages and the counts. So this would be another important footnote to read in order to orient yourself as to how the columns were calculated. The final rate table that I would like to present is the all UTI events rate table. And for this one, we would go to the HAI module and to our all UTI and click on Run Report under the rate table. So here we see again that column 2 tells us this is by year and month. Column 3 is your UTI count. Column 4 shows the number of new prescriptions of antibiotics given for residents suspected or diagnosed with a UTI for each month. Column 5 shows the UTI treatment ratio, which is calculated by dividing the number of new antibiotic prescription starts, column 4, by your total resident days, column 6. Column 7 is your UTI rate, and that is calculated by dividing your UTI count in column 3 by your number of resident days in column 6 and multiplying by 1,000. Column 8 is the number of catheter days per resident in your facility by month. And column 9 is your catheter utilization ratio, and that is calculated by dividing your number of catheter days by your resident days in column 6. So, as I mentioned before, the tables that I've shown so far are what the NHSN application produces standard. So if you click on run, these are the tables that you will get. However, let's say you wanted to modify the tables. Either you wanted to eliminate a column or maybe add more information. In the next few slides, I'll go over an example. I'll use the CDI lab ID events table that we just saw, the line listing, to show how to modify this particular line list to add a variable. So to do this, you would return to your lab ID events, all CDI lab ID events. Under the line list, you would click on your second option, modify report. So clicking on the modify report option takes us to the modify page, where there are different tabs that represent each areas that can be modified in the report. So we'll go through a couple of these tabs. So the first tab here lets you title your modified report. And also you can pick the formatting. So you have a choice of HTML, PDF, or Excel. The HTML format is what allows the report to pop up in a separate window. You could also have chosen to produce the report as a PDF or Excel file. In the tables that I've shown previously, we were looking at all of the data that had been entered by our hypothetical facility. However, let's say we wanted to focus on 1 year. This would be the tab that you would use to modify the year that you were looking at. So here, if we click on time period, we could choose the event date by year month, and you would use the month and year. So in this case, I want to look at the year 2015. So I would look at January 1st, 01, 2015 to December 2015. The filter option is not something that you would need to change very often. In this case, I've left it as the standard. It's a specific organism type, which is what we're interested in since we're looking at the all CDI lab ID event table. But I just wanted to show it just so you see there are other options you could use if you wanted to filter your data differently. Under the display variable tabs, we can select the variables that we want to see in the line list. So under the available variables section here, these are all of the variables that you could possibly add in your table. The selected variables section are the variables that we currently have in our table. To see more descriptive variable names, you could click on the box ahead on top of all of these tables, and that will show you your variables, but you'll have more descriptions of what they are. So in this case, I'm interested in looking at the CDI assay variable. And this variable is the one that will tell you whether or not your events are incident or recurrent. So what I do, first I click on the CDI assay, and I click on the selected button in order to move it over to the select variable table. And you can see here that it's moved over. And you could have done the same thing if you wanted to remove any of these variables from your selected variable section back to the available variables. So you would click on any one of those and select the opposite way. And that would remove that column from your table. The Display Option tabs allows us to display the data by resident ID or event ID. In this case, I wasn't interested in displaying it in any of these, so you can also have the option to just leave it blank. So we'll have our full table without any of these. So if we click Save, you'll see here, this is your analysis report name. In this case, I've labeled mine All CDI Events March 17 Training. It gives you an option to overwrite existing. If you had a previous table that you were working on, and you went back and you made more changes, you could overwrite the previous table, or you could create a brand new table. So you would click Save. Once you've saved your table, once you save this table, it is then located under Custom Reports back in your menu options for all CDI events. So if you could save as many, you could modify and save as many tables as you need. In this case, you could see here it is here. And if you needed to see it again or to modify, add or remove more variables, you could click on this table here, and it would give you the options to either run, modify, or delete the report. So this is the table that we've modified, and you can see here now we have 10 columns as opposed to 9, since we've added the CDI assay, and it tells us which of our events are incident or recurrent. Also, our event date now has all of our events from January 2015 through November. So these are all of the events that were entered for 2015. So I want to leave you with some general tips for analyzing data in NHSN. The first thing is to develop a timeline to regularly analyze facility data entered into NHSN. So you want to consider a frequency that will allow for timely feedback and interventions if necessary. Next, I would again emphasize the importance of regularly generating your data sets before you analyze the data. Also to remember to read your footnotes for your reports, as they contain information that would help you interpret the reports themselves. And this is some information on the available resources available on our page. And for any questions that you may have in the future as you're using these reports, you can feel free to email us at nhsn@cdc.gov. Thank you. So, anybody, any questions?
I just have two questions. Sure. The first one is on the analysis reports where you had the line listing with all UTI events. Could you go back to that slide?
Sure. Let me.
Okay. I have page 19 in my book, but I don't know what slide that number would be.
We'll go back.
It was in analysis reports.
The total, not the rate table, the line list?
No, the line listing, yeah.
Okay.
Please. No, keep going. Right there.
Okay.
Okay, so in column 6, for those first 4 rows, it's empty. So I guess I'm kind of curious as to why that is, because wouldn't we have put in what it was? Is that something I would need to do some data checking on?
Okay.
So the first 4 rows?
Yes, I see what you mean. So this is something that we have noticed. And so I would say one of two things. If you notice this in your, because this is a test facility, of course. So I don't know, this may or may not occur in your data set. But if you did notice something like that, I would go back and check and make sure that you are clicking all of the criteria that Angela mentioned before when you were filling out the UTI event form, and to make sure that you've clicked so that your category is showing up at the bottom.
Okay.
In the test facility, we have noticed that in certain cases you could click and have no category show up. If that is occurring, you want to go back and review what you're clicking, and if that still is occurring, you want to send us an email just so we can check.
Because otherwise, would that data be included in your?
That would be incomplete.
Incomplete, okay.
But yeah, so that's why you want to make sure what's going on. That's a good question. Thank you.
And then that last question, I wanted to get to the rate tables for the total UTI rate, because I'm just kind of curious. I want to make sure I understand this.
Okay.
It says rate tables, total UTI rate.
Is that the one? Yes.
Yes. Okay, now I'm a little confused. So if I go to row 1, and I'm looking at that UTI treatment as 3.33, 10 divided by 50 doesn't get you 3.33. 3 divided by 10 is. So I'm wondering, either I'm misunderstanding it.
No, it is the correct thing is column 4 by column 6. In this case, I have to apologize. This was at a time where this particular table was having a glitch. So disregard like what you see here, since it's kind of like junk data that we've entered in just to see what would happen for this particular one. But in this case, so
I don't know. If you go to the second row, 50 divided by 150 doesn't get you 50. It gets you.
So wait,
I'm wondering if it should be column 3 divided by column 4. Instead of column 4 divided by column 6.
So the UTI, that's the number, the UTI ratio. So it would be the UTI start divided by your number of resident days. Total UTI count. Okay, all right. So yeah, so it would be the UTI start divided by your total UTI count.
Okay.
Yeah, sorry about that.
No, I just want to make sure if I understood it right.
So your denominator, so just to make sure, especially for those listening in, so your denominator here is not column 6, but column 3. So your UTI count, column 4 divided by UTI count.
Okay, thank you. I thought I was.
Okay, thank you so much for catching that.
Hi. Ever since the new version came out, it seems that when you're running an analysis with the old baseline, you can't modify a report, such as a rate table. Is that going to come back? The ability to modify, like you were showing how to modify the report, you can do that under the new baseline, but you can't under the old baseline.
When you say new baseline, what do you mean versus old baseline?
Well, I'm both the hospital, so I don't know if it's different, but running the old baseline, we can't modify the report.
Oh, is that?
It's a different component.
Right.
Which is incorporating different data than what you have in long-term care. So it wouldn't impact long-term care. Right. Oh, sorry.
Okay, so I probably should be asking this tomorrow.
Yeah, you should ask that question again tomorrow, because there's not a baseline calculated for benchmarking facility reports or facility experience. So what's happening in patient safety around the change in the baseline isn't relevant to long-term care.
Okay, sorry.
That's okay. Can I get in the back first? Is your microphone on? Do you want to come up here?
Is it on now?
Yes.
Hey, considering that some of the facilities, like in North Carolina, we're into the enrollment piece right now. And is it a possibility that you would have resources starting maybe April, having maybe a monthly time that we would have access to a live person with NHSN that we could ask these questions? Because I know I'm going to have questions, and to support all the facilities, the 87 facilities I have, to answer some of these questions, it would just be really awesome if we had a live person. No.
No, just a second.
Is that a no?
Just 1 second. I'm waiting for...
We appreciate that remark. We've heard it from others. At this point, we wanted you to continue to use the inbox, but we're looking into opportunities. If you were here from our presentation this morning, that's something else that we've documented, that there's a need out there that we need to meet somehow. So we're a mighty team, but we're a small team. And the capacity exceeds our ability, so we have to be creative. I know there's opportunities with the NCC for us to meet needs through the QIO, so that's a venue. We've also entertained the idea of doing regular webinars and newsletters, so you all have additional opportunities to interact with us. So, okay. Stay tuned. Things are coming.
I'm hoping. Thank you.
No problem.
Thank you.
Can you differentiate custom and published reports? Is it similar to the hospital side?
I think for the NHSN side, we have custom reports. I don't think we necessarily have published reports. Published reports.
You showed it in your
Right. Hold on. Right. That is... Actually, the published reports I have not... Let me see.
It usually makes it visible to others that
Correct.
have access to that organization.
Correct.
Is it the same for long-term care?
Long-term care, I think it would be. I've seen the published reports used in the group setting, not necessarily. So I think if you do have a report that you saved as published, if you are part of a group, then your group can see it. Otherwise, if it's a custom report, only your facility can see it. Only you, the user that created the custom report, can see that report.
So if we have multiple users within one facility, they could see a published report.
Correct.
Right?
Yes.
Thank you.
Anything else? Thank you.